You may have heard warnings about the dangers of compounding pharmacy. Well, the biggest one of those supposed dangers is that compounding pharmacy is unregulated. Well, I'm here to tell you that that is absolutely 100% completely untrue. I was a compounding pharmacist for over 20 years, and I literally quit my job precisely because of the overwhelming amount of regulations that I had to deal with on a daily basis. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education resources. Most of those resources are about hormones and hormone optimization. Now, this video isn't exactly about hormones, but it is about compounding pharmacy, a topic that's very closely related to the idea of hormones and hormone optimization. I want to address the biggest criticism against compounding pharmacy, namely the idea that it's not regulated. I also want to help patients and providers understand the crucial role that compounding can have, especially in the area of optimizing hormones for both women and men. And I want to offer some practical tips, some guidelines, and some suggestions that both patients and providers can use to find a quality compounding pharmacy that they can really trust. If I could only explain one thing about compounding pharmacy, it would be an answer to the idea that it's completely unregulated. Let me ask you something. Do you have a doctor, a primary care physician, an OBGYN, maybe a nurse practitioner or a PA that you see somewhat regularly? Tell me what federal agency of the U.S. government is in charge of regulating your doctor or your nurse practitioner. You may not realize this, but the answer is that there isn't one. There's no federal government agency that has the jurisdiction to tell doctors what they can and can't do, or to punish them if they've done something wrong. Doctors, PAs, nurse practitioners, those are all regulated by either the State Board of Medicine or the State Board of Nursing, or both, in the states where they're licensed. Compounding pharmacy is regulated exactly the same way by the State Board of Pharmacy in each state in which it's licensed. The Food and Drug Administration is a federal agency that's chartered by the U.S. Congress to oversee the manufacture of drugs by pharmaceutical manufacturers, which is different than compounding. Compounded prescriptions are explicitly exempted from the FDA's jurisdiction. That's because a compounded prescription is based on a physician's ability to prescribe whatever medication, or in this case, hormone, he or she feels is best for their particular patient. There are lots of examples of situations where an FDA-approved, commercially manufactured drug product is not the best option for a patient. I'll talk about a few of those in a minute. But federal law explicitly allows prescribers to use their own discretion, their professional judgment, to make decisions about what a patient is taking based on what's best for the patient in the physician's opinion. For centuries, pharmacists in the U.S. have been allowed by law to compound prescriptions based on the explicit instructions of a physician. Have you ever seen that little RX symbol that's sometimes on a written prescription, or it's even seen on the sign of maybe an older mom and pop style pharmacy? That little RX is an abbreviation for the Latin word recipe. Sound familiar? Recipe, which means take thou. In other words, a prescription actually says in Latin, take these ingredients that are listed on this page and compound a prescription for my patient out of those ingredients based on my recipe. After letting you know that compounding pharmacy is absolutely regulated, only in a little different way than pharmaceutical manufacturers, the second thing that I'd probably tell you about it is that compounding pharmacists are dedicated healthcare professionals who care deeply about their patients, just like physicians, nurse practitioners, and PAs do.
A doctor's prescription may seem mysterious to the average layman, but it's all very simple to the pharmacist. It may contain chemical names or abbreviated medical terms, but the pharmacist understands it perfectly. It is his responsibility to make sure that each prescription is filled exactly as the doctor has ordered. Accuracy and skill are synonymous with pharmaceutical technique. An error in the compounding of a prescription could be injurious or even fatal to the patient. So the pharmacist must take every precaution in his work. He checks and double-checks both the instructions and the required ingredients. The pharmacist, in common with all professional men, has a responsibility for ethical and conscientious service to his community. For at one time or another, human life will depend on his ability, accuracy, and integrity.
The perception of what a compounding pharmacist is and does ranges all over the place, from the tottering old drunk, Mr. Gower in the holiday classic film It's a Wonderful Life, to someone cooking meth in a garage like Breaking Bad. That image of poor old Mr. Gower dropping cigar ashes onto his arsenic capsules at the pharmacy counter is woefully out of date. Instead, maybe you can imagine an immaculate clean room filled with $10,000 powder containment hoods and $4,000 analytical balances that can weigh down to a milligram of powder. In a modern compounding pharmacy, you'll find pharmacy technicians who are dressed head to toe in personal protective suits. They'll be highly trained subject matter experts who have their compounded preparations tested and retested on a regular basis to make sure they continue to meet those compounding standards that they're held to. Compounding pharmacies send out samples of their preparations on a regular basis to be tested. My pharmacy spent tens of thousands of dollars every year on testing our compounded preparations. A little side note here. When I was the lead compounding pharmacist at a pharmacy, I was personally responsible for testing compounds at my pharmacy. And I can't think of more than one, maybe two of those tested compounds that came back outside the acceptable limits, based on what's called the United States Pharmacopoeia Standards, or USP. We were even told by an accreditation board that we could back off on our testing, not test as much, because our tests always came back within 1 or 2% of the potency that they were supposed to be. And usually the limits were plus or minus 10%. The third thing that I'd like you to know about compounding pharmacy is that it's an absolutely essential service for millions of patients who rely on compounded prescriptions every single day. Well, here are just a few crucial examples of how compounding makes a difference for people. The woman who takes oral estradiol capsules, she gets hot flashes at a 1.5 milligram dose, but breast tenderness at 2 milligram. That woman needs to have a compounded dose of 1.6 or 1.7 milligrams, which is impossible to get by breaking commercially available tablets. By the way, that woman is my wife. Extreme progesterone intolerance, severe, even suicidal depression and paralyzing anxiety from 100 milligrams of progesterone. But that woman has extreme insomnia, sleeping only 2 or 3 hours every single night. She needs a compounded progesterone capsule. Maybe 10 milligrams, gradually increasing by 10 milligrams at a time over several weeks or even months. A peanut allergy. Commercially manufactured progesterone capsules contain peanut oil. A woman with low sex drive, loss of muscle weakness. If her doctor prescribes testosterone, good luck taking a foil pack of androgel, which is for men, and trying to get 1/10 of a man's dosage out of it. A woman who emailed me recently about cutting her estradiol transdermal patches in half or in quarters, or was it in sevenths? She's asking me, how am I supposed to get the right dose? Well, a compounded prescription cream or a gel could be tailored to the exact dose that woman needs. My friend Dr. David Rosensweet has developed organic oil bases that are compounded with hormones, applied to the skin in both men and women. Dr. R's patients do much better on compounded oils than they do unmanufactured hormones. Some patients can't tolerate or absorb oral or transdermal hormones, and they require a sublingual troche, a lozenge, or a rapid dissolve tablet. A healthcare practitioner has the moral obligation and, as of right now, the legal right to treat the patient with the hormone or medication that works best for that patient. So how do you find a quality compounding pharmacy that you can trust? Well, in general, I'd recommend that you do a little research. And there are three things that you can look for. Number one is to look for a pharmacy that has some type of accreditation from an unbiased third-party accreditation organization. The pharmacy I worked with in the past was accredited by the Pharmacy Compounding Accreditation Board, or PCAB. There are other accreditation bodies that offer accountability for your compounding pharmacy, and they can kind of guide you in the right direction toward pharmacies that have opened themselves up to that kind of accountability. My personal experience is that accreditation audits or inspections, they're brutal. They look at absolutely everything in a compounding pharmacy to make sure it's meeting those compounding standards from USP that I already mentioned. The things an accreditation body will look at will be facilities and equipment. Is everything in good working order? Is it clean? Is it calibrated regularly and kept well maintained? Are the personnel and training up to date? Are the technicians and pharmacists licensed and trained to do their jobs? Are they tested and retested to make sure they're up to the latest standards? Raw materials, are they purchased from FDA licensed manufacturers? Do they meet standards of the USP, the United States Pharmacopoeia, or what's called the National Formulary, or NF? Testing. Does the pharmacy conduct testing with an outside lab to determine potency and purity of their compounds? The next step you might want to take is to have a conversation with a compounding pharmacist. I have some suggestions for some possible questions to ask a compounding pharmacist. Things like, are you accredited? If so, who with? And what did your last inspection report find? Have you had any strikes from the FDA or from the State Board of Pharmacy? Do you test your compounded preparations? What have the results of your tests look like? Have you had any recalls of your compounds? If they have had recalls, that's not necessarily a bad thing. But what were the circumstances? What did you do to correct those problems? If your healthcare practitioner uses and trusts a compounding pharmacy, ask him or her why they trust that particular pharmacy and what their experience has been with that pharmacy. Well, if you've ever received benefits from a compounding pharmacy and you don't want to lose those in the future, you might consider joining with the Alliance for Pharmacy Compounding to help protect your doctor's right to prescribe compounded prescriptions, as well as your ability to receive the essential compounded hormones that are best for your particular health situation. As the Alliance for Pharmacy Compounding website says, based on a flawed report that it commissioned, the FDA is signaling that it may severely restrict compounded hormones. This could be a serious health crisis for millions of people. I'd encourage you to visit compounding.com and watch the featured videos that are on that page that can explain how you can get involved in protecting your right to compounded prescriptions. If this video has been helpful at all, click the like and subscribe buttons. You might want to also ding that little bell to make sure you get the notification anytime I post a new video. Thanks so much for watching, and I'll look forward to talking to you again next time.